But first, June is Men's Health Month, and we want to tell you about an event that's happening right here in DC. It is called the Black Health Connect, and it serves as a hub for Black healthcare professionals. Joining us now to tell us more about what we can expect at the event is one of the event's keynote speakers, Dr. Tomlinson. Welcome to Great Day, Washington.
Oh, thanks for having me.
We brought you in as there's severe storms coming too, so sorry.
That's always great too.
Thank you for being here. What are you doing in DC on your trip?
Yeah, so I'm in DC here for a keynote speech at Black Health Connect, and the goal is to get people who are inspired to change healthcare.
Okay, all right. So you'll be speaking to a room of professionals?
Well, hopefully I'm speaking to thousands of people, but it's healthcare professionals, it's young, aspiring leaders, but also leaders in the healthcare space and kind of coming together to figure out how to solve problems.
And it's not just one day. This is going to go on for several days,
Yeah,
right?
it's actually for 4 days in total.
Okay.
I speak tomorrow if you want to come out and watch me.
Okay, and people will be learning about how they can elevate their practices since they are professionals in the business, or what will people get out of the conference?
I think it's elevate practices, how to connect with patients, how to come together to create better opportunities, innovate around healthcare. You know, healthcare right now is being a little disrupted, and so you want to make sure that everybody has an opportunity to receive healthcare. Yeah.
Okay, we mentioned at the beginning, June is Men's Health Month. What can men be doing to improve both their physical and their mental health?
I would say the biggest thing is to talk about it. You know, I mean, myself included, we tend to just sort of, you know, dial in and say we're fine. And so the key is to talk to people about it, especially mental health. You know, you're trying to fit into a box that maybe you don't normally fit in, and society forces you in a box. Really just be yourself and reach out to people when it comes to getting screened for prostate cancer or blood pressure, or whether it's just talking to somebody about feeling down or anxious.
Is it true that men wait a long time? Like they'll feel a symptom, but they don't go in to see a doctor?
I think I wait a long time, but actually I am a man, and I think we wait a long time. We wait till something's fallen off before we get checked.
Like you just kind of tough it out and you keep pushing through.
It's kind of the way, you know, the box that's been built for us by society.
Right. Well, you have this new book, which is great. It's called Less Than 1%. This is kind of a way to be authentic, is that right? And show up in the world as 100% yourself? Yeah,
I think it starts with me. It's not about me, but it starts with my story about being a sort of a CEO that no one thought I could be a CEO of this big, large healthcare company. And then I really look at different things that happen in society where we try to pick winners and losers before the race is even run. And so I really get upset when people are put into a box, and I try to imagine a world where we just gave an opportunity for everybody to have an opportunity to be great.
Because you expect a certain person to walk through the door. You already think this person is who's going to be good for this role.
Absolutely.
Yeah, okay. How do you disrupt that status quo then? Is there a way for someone who has been put in the box their whole life to say, here's how you step out of that?
I think there are 3 different ways that you can do that. One is be disagreeable, which, which
that's hard for me.
That doesn't work for a Great Day, Washington, but be disagreeable. Really don't accept what the box you're in. Don't accept things. Really have an inquisitive mind to find out if that's the right or wrong thing. The second is be optimistic. Imagine a world where that problem is solved. And then the third is relentless. Never give up, no matter who tells you that you can't do something.
Okay. Well, for people who said, this has been inspiring today, we want to hear more from you. Can they come hear your keynote tomorrow?
Yes, they can come hear my keynote. They can go onto the website, www.blackhealthconnect.com, and they can you look for my keynote. It'll be tomorrow night, and but otherwise it'll be live streamed, and they can also check me out online if they wanted to.
Yeah, where do they find you online?
Tomlinson.com.
Okay, perfect. Are you ready? Do you have certain preparations that you do the night before?
No.
You give a big keynote?
You know, I'm a little nervous, but I think nervous is good because that's what you do to prep for game day.
Right. So. You're excited and sharing your purpose and your story. Thank you for being here today.
Thank you for having me.
We appreciate it. Okay, you can buy tickets, so you do need to get tickets, right, to come here and speak. It is for the Black Health Connect. You go to blackhealthconnect.com. There's all the information right there. Go see Dr. Tomlinson tomorrow. Thank you for being here.
Thank you so much.